In my last video, we spoke about contraceptive methods that are available in most Ghanaian hospitals. Today, I am here to share with you some side effects of one of those contraceptive methods. And one of such methods is the IUCD, the intrauterine device. The intrauterine device. Okay, so IUD, as I said, intrauterine device. Why is it going to be inserted into your uterus, into your womb? So if IUCD is going to be inserted into your womb, the womb will respond. So immediately after insertion of IUD, or after some minutes or hours, the client will start having contractions, cramps, pain, lower abdominal pain. This is normal. It will go off after a few days. IUD cramps will go off after a few days. So if you had an IUD today and you are having cramps and you don't know what to do, just take a painkiller. It will wear off. Or put a hot water bottle on your tummy. It will go down. Okay. The next side effect is bleeding pattern changes. If IUCD is inserted for you today, then you can spot. So this was introduced into your uterus. So after the provider has placed this into the uterus, bleeding can start, and this is called spotting. After a day or two, it will stop. All right. And then your monthly period, it may change. It may become heavier. So if you have gotten an IUD and you are bleeding heavier, don't be alarmed. It would reverse, or it will change after a while. So heavy bleeding is normal when you get an IUCD inserted. Okay, IUCD expulsion, yes, is a side effect, but not for most people. For some women who might bleed so heavily, sometimes the IUCD may expel or come out. So if you are having an IUCD now, I would advise anytime you remove your pad after your menses, please don't just wrap it and throw it away. Always be careful to check your pad if everything is okay. Expulsion does not occur frequently. Maybe in 100 people, we may get one person having an expulsion. All right, IUCD side effect, infection. It is not the IUCD going to give you an infection, but if you are someone who does not take care of yourself well, as a woman, vulval hygiene, vaginal hygiene, if you don't do that very well, you may cause infection for yourself, because this IUCD is a new person inside your uterus. And if you are not taking care of yourself and you are always having candida, you are having infection, itching, this might prolong your infections. So if you are going to insert an IUD and you know and you suspect you have candida or any other infection, you have a fishy smell, kindly treat before you go in for an IUCD. I hope this helped. So side effects of IUCD: 1, cramps; 2, bleeding pattern changes; 3, expulsion; 4, infection. This is not caused by the IUD. It is caused by yourself if you are not having a good vulval hygiene. So if you want to use an IUD, lady, I beg you, wash yourself well, clean yourself well. If you happen to have an infection, treat it very well before you go in for this device. Have a nice day.